Hello, doctor.
Ask your doctor or pharmacist if Pharmadynamics has an affordable generic suitable for you.
We've been inundated with questions from viewers on the subject of fibromyalgia, a syndrome that is characterized by long-term body-wide pain and tenderness in your joints, your muscles and other soft tissues, often linked with fatigue, depression and sleep disorders. It's most common amongst women between the ages of 20 and 50, and we're joined by someone who just sneaks into the lower end of that age bracket, adrenaline junkie and breakfast radio host Charmaine. Charmaine, great to have you with us.
Thank you very much.
And sitting next to Charmaine is Dr. Bavi. I was going to say Vythilingum. Did I say that right, Bavi?
Vythilingum.
Vythilingum, there we go. But
there.
Bavi, as you said, just likes to be known as Bavi. Also, very special interest in women's health. Now, Charmaine, you were diagnosed with fibromyalgia towards the end of last year, but that was a really long journey to get to that diagnosis, wasn't it?
It was a very long journey. I think I've had fibromyalgia since I was in my teens, late teens. When I was about 24, I started getting my first migraines. But for as far back as I can remember, I've always been extremely tired and I struggled to sleep. And it just progressively got worse. It's actually quite debilitating.
So you were 24 when that started. You're now 25. I mean, it's... just had to drop that in there. No, it's been a couple of years since you were 24.
It's been a couple of years.
How come no one diagnosed fibromyalgia?
I've been for blood tests. I've asked every health professional I know what the problem could potentially be. No one has come up with an answer. I was becoming so frustrated with the fact that I was so tired all the time. And that in itself was causing more stress and anxiety. I just couldn't get to the bottom of it because I'm a naturally very energetic person and I love adventure and exploring but so tired all the time.
To be diagnosed with fibromyalgia, you must have at least 3 months of widespread pain in the absence of any other causes of pain. And there is no known cause, but there is a hypothesis of fibromyalgia that if someone that's predisposed to the condition has a stressful event, symptoms start occurring. So was that your case, Charmaine?
I've had several very stressful events in my life, traumatic events. First was when I was a teenager, around about the age of 15. When I was 16, I was hospitalized with a spastic colon, and then just several very traumatic events thereafter. 3 very important people to me died within a year of each other. So my father died very suddenly, a friend was murdered, and then my grandmother passed away. So all within a year. So I don't think my body I didn't have a chance to recover from each of those very traumatic events.
Bavi, how would you respond to that kind of stressful trigger? Would you agree with that hypothesis that something like that triggers fibromyalgia?
Absolutely. The thing is, stress is both a physical and a mental thing. Extreme stress definitely changes the way in which the brain processes events and processes signals from our body. And that's really a huge part of what fibromyalgia is. It's the brain abnormally processing the normal signals from muscles, joints and tissues. And that's what's giving you the pain and the fatigue.
I talked about people earlier predisposed to the condition. What sort of people are predisposed to fibromyalgia?
It's really difficult to say because fibromyalgia is quite common, but it's definitely women. And as you said, women between 25 and 50, women in their reproductive years. So there's something about female hormones that predispose us to getting fibromyalgia. People who've got family histories of fibromyalgia. So there's a genetic component. And then there's this big link between fibromyalgia, depression, spastic colon or irritable bowel, as you said, and migraines. So there's this cluster of diseases that seem to link together.
So let's talk about that connection again, because you've experienced both. How do you see that connection?
Well, I mean, there are multiple connections. The first is quite an obvious one. If you're in chronic pain, you're tired all the time, you can't do what you love to do, that's going to make you feel depressed. The second thing is that, as I mentioned, fibromyalgia seems to be about the brain processing signals abnormally. Depression is a brain disease, and part of depression is that the brain, again, is processing signals abnormally. And it seems that in certain types of depression and fibromyalgia, you've got a common underlying disorder. And then thirdly, you can have some of the medications that people may take erroneously for fibromyalgia. So if you're taking too many sleeping tablets, if you're self-medicating with alcohol or other drugs to ease your pain, if you're taking painkillers in excess or the wrong kind of painkiller, that could lead to depression as well.
Charmaine, now that you know that you have fibromyalgia, how does that change things? You have something to kind of latch onto and say, okay, I've got a diagnosis. We can't cure it, How do you treat it? How do you manage it?
Well, it was a huge relief finding out that I actually had a condition. Not being able to understand why I was so tired all the time and why I was in such pain all the time and the migraines was so frustrating. So having the diagnosis certainly has helped a long way to just emotionally it's a relief. I'm not managing it very well, I have to be quite honest with you.
We know, we listen to you in the mornings.
I'm not managing it very well. The greatest problem is sleeping, because you never get into that REM sleep. I never get into deep sleep, so I never wake up feeling revitalized and energized. So I wake up even having maybe 7 hours sleep, still wake up feeling terribly thick, and my head feels very foggy, and I always feel very tired, like I'm dragging myself through the day. And so my challenge is getting to bed earlier, trying to feel more relaxed before I sleep, and then trying to have a good night's rest.
Okay. So you've concentrated on the sleep side of things. Bavi, how would you treat fibromyalgia?
Well, I mean, I think it's a holistic approach, really. And as Charmaine said, sleep is really important. The second sort of key thing in fibromyalgia is exercise. And it may seem counterintuitive because your muscles are sore. Why would you want to exercise? But the thing is, you have to exercise, and you've got to do the right kind of exercise for you. And exercise works in several ways. It's pain reliever, it's de-stressing. It also retrains the brain to learn what are normal signals from muscles. And exercises, gentle exercises with stretching are particularly useful, like yoga, Pilates, that type of exercise. But whatever works for you is great.
Okay, not on your motorbike, Charmaine. Charmaine and I got our motorbike licenses together, by the way.
Yes, we did.
Remember that?
Yeah, I remember that, yeah.
Bavi, what about antidepressants?
Antidepressants definitely have a place in fibromyalgia, and in two areas. The first is in pain management, and low doses of these antidepressants definitely help with chronic pain. And then again, if somebody has got depression, we use it to manage the depression and to manage the mood symptoms.
Okay. Charmaine, this is a tough condition to have, fibromyalgia. As I said, no cause, no cure, needs to be managed very carefully, and it's a long-term thing. How would you give someone who's suffering or experiencing what you're experiencing hope? How would you encourage others with fibromyalgia?
I've probably reflected on what my GP said when he gave me, he didn't give as much of a diagnosis. I think doctors are very reluctant to give a diagnosis of fibromyalgia, but he said, yes, that is most likely the case. And he said to me, the thing to do is, because you suffer with anxiety and often depression, is to find all the things that bring you joy and then do them as often as you can.
Wow. And don't feel guilty.
And don't feel
amazing,
guilty.
Yeah? We don't do the things we love doing because we feel guilty about that.
Exactly.
Doesn't make any sense at all. Up to a third of all visits to the doctor offer symptoms that resemble those of fibromyalgia. So it's common, but that doesn't mean you have to live with it. You can do something about it. It's your health. It's your responsibility. So Bavi, Charmaine, thank you so much for your insights and sharing your testimony, Charmaine. That's great. More than 2/3 of us will have or will experience back pain in our lives, which is why keeping your back strong is essential, as Lisa will tell you.
Ask your doctor or pharmacist if Pharmadynamics has an affordable generic suitable for you.
I want to live the best life.